let us start the session, and I hope all the questions are ready so that I can answer in whatever I know about that question. So a lot of questions on the book, sorry, on the WhatsApp. I'll just first check the WhatsApp. Yeah. So there was okay, I had to discuss a case also. So first, basically, we'll discuss some of the questions and then go to the case which I'm going to discuss today. Now, you see, there was a question. There was a question basically about throat complaints from a doctor that the anxiety and the apprehension is felt in the throat. Now, if you go to see, this is sometimes a very what you call very interesting symptom also, and sometimes I always say that you have to be lucky to get these type of symptoms. So if you are lucky to get these type of symptoms, then you have to basically see which remedy comes into that. Now, this is a very typical symptom. This is a very typical symptom of a very interesting remedy. For example, patient comes and tells you that whatever I have, whatever I eat, or whatever I think, my stomach starts having butterflies in stomach. Now that is something different. But here the patient is saying that he has apprehension in the throat. A very, very important remedy. That is cannabis sativa. Cannabis sativa is an interesting and a very fantastic remedy when there is apprehension or anxiety is felt in the throat. Now you must remember that cannabis sativa is a hot remedy and a thirsty remedy. A very interesting symptom of cannabis sativa that I have seen in my practice, and I have seen in many of cases of my patient. There is hot water as if poured over the heart. Now this I have seen in so many cases of cannabis sativa. Before telling you this symptom, I have seen this in many of cases. So do think about this symptom of cannabis sativa as if hot waters were poured over him over the heart. I have seen this symptom in many of cases and given cannabis sativa only in this symptom, and that has given me very good results. Of course, you must think cannabis sativa in the gonorrhea of the first stage when there is burning after maturation and discharge is like very the discharge of the urine is basically thick yellow and pus like. It is thick yellow and pus like, and that is basically cannabis sativa. So and a cannabis sativa patient, comes and tells me कि छाती में, Hindi में I'll tell you, गरम गरम लगता है. There is a hot feeling in the chest and somebody is pouring something in the chest. This is basically a very interesting symptom of cannabis sativa. The remedy has come. That's why I'm telling you some symptoms, what I know. And one symptom, the maturation in cannabis sativa is in split stream. It is split stream with a spasmodic closure. This is important of cannabis sativa. So I welcome Dr. Maru, Good afternoon, Dr. Visha. Good afternoon, Dr. Babal, Sunita, Smita, Alexandra, Dr. Mishra. So here basically, this is a symptom of cannabis sativa. Of course, cannabis sativa, I think 200 was given by the doctor and he improved very well. Dr. Samma, good afternoon. Next, there was one next symptom, question which is there on the WhatsApp, and the patient has specifically told me about the appetite. Okay, whenever the patient has appetite, he basically eats the food, and after some time again he feels hungry. So this is again a very important symptom, a symptom which has to be noted and prescribed, because this is a very, very striking symptom. That is, appetite returns after eating a few mouthful. It means the patient says that I'm very hungry. He eats some food. He says I feel full. Again, after some time, he feels hungry. Problem is what happens that every time this symptoms comes, and we always think that maybe this symptom, few mouthfuls, fills up the throat, and we start giving lycopodium. Now, apart from lycopodium, there are many of drugs, and this symptom, that appetite returns after eating a few mouth, is actually not present in lycopodium. In lycopodium, he's very hungry. He eats maybe a few morsel and he feels happy and satisfied. But here is a symptom where the patient comes and tells you that I feel hungry, I eat few morsels, and I feel satisfied, but again feel hungry. In this case, my dear friends, write down Nagpur is not indicated. The remedy is China. A very interesting remedy, China. And second remedy that you should always remember is Calcarea car. The symptom is appetite returns after a few mouthfuls. This is very important. And that is China and Calcarea cup. Apart from these other drugs also, but I have used these remedies and seen the results in my practice. Good afternoon, Dr. Meera. And Dr. Meera had a very good experience of treating corona patient. I think she'll be able to give you some insight where corona positive patient, her mother was there, and after the medicine, only homeopathy medicine, the patient came from positive to negative with homeopathy medicine. So I think that's a very good thing, and it is so important that doctors who are following me and attending me basically are seeing results in their relatives, with their close associates, and I'm taking the medicines also. So it becomes very transparent and you get a lot of confidence in the doctor who is actually teaching you and also in doctor who is treating you. So I think Dr. Meera would like to share her experience sometimes that her mother came after the treatment, she came negative in about a few days time. Hello, Dr. Tony, Disha, Dr. Lisa, good afternoon. So this is basically how often do you give the nosode of corona? Yeah, I've given in many of patients. I would say, Dr. Babel, more than 500 cases I have given nosodes, and I have found fantastic and very good results with the corona nosodes. I have sent to few of the doctors also. I hope they must have got that medicine. You also give and try that nosode and you will see repetition. Yeah. So I told you this. If it is a case where it's a full flared up case of corona, then I give 4 pills TDS for 3 days as a prophylactic, 4 pills BD for 2 days. That's how basically I give. Hello, Dr. Patel. Good afternoon. So this is what I'm telling you about this corona nosode and the case. One case which I will discuss today. So a patient of 81 years of age had a fall on the back and there was no fracture as such, but in 2 or 3 days time there was a lot of dehydration. There was a lot of dehydration and the patient in fact could not walk also. Admitted to the hospital, and in the hospital we found that the tongue had that thrush, the fungus. So patient could not eat the food also. The treatment was started, and the very important symptom, the patient basically wanted to pass a lot of urine, always very restless, itching was there here and there, and could not sleep properly, always asking what will happen, speech very slurred and all. Which remedy comes to your mind and how did we treat that case? That is so important, how can we get it? Okay, I told you before, Dr. Sunita, I have sent to a lot of doctors. You can always contact my front office and get that nosode. So this was the case. What remedy comes to your mind? Anybody? A case had a fall on the back, very weak, totally dehydrated, admitted to the hospital, create on the borderline high, no appetite, slurred speech, in the night could not sleep, always itching here and there, and lot of other symptoms. Okay, so we have a lot of post, Dr. Miraya. So see, Dr. Meera has already given her testimonial, as we say, and that is a live testimonial, very transparent, and we are also very happy that she responded very well to the treatment, and from positive she came to negative with only homeopathy medicine. So thank you, doctor, for sharing the testimonial, because it gives weightage to what I say. Okay, डॉक्टर मिश्रा ने सवाल पूछा है, केस ऑफ 50 years of age, we shall treating along with delivery because of plenty of pus cells. डॉक्टर मिश्रा, अगर कोई भी सिम्टम आपके पास नहीं है, फिर भी अगर उसके बहुत सारे पस सेल्स है, तो 2-3 दवाई आपको सोचना है. सबसे पहले तो कैंथेरिस है, वो आपको सोचना है. एक रेमेडी जो बहुत रेयर है बट बहुत इंटरेस्टिंग है, दैट इज क्लेप्सिला। रेयर दवाई है, अगर मिलती है तो ठीक, नहीं तो मत दीजिए। तो कैंथेरस सोचिए। उसके बाद एक रेमेडी है जो जब यूरिन के अंदर बहुत पस आना शुरू हो जाता है, जब यूरिन में बहुत तकलीफ होना शुरू हो जाती है, एक रेमेडी जो बहुत अच्छी काम करती है उसके अंदर, वो है टेरेबिंथिना। बहुत अच्छी रेमेडी है टेरेबिंथिना। और तीसरी रेमेडी जिसके अंदर ये सब सिम्टम्स, दैट इज फॉस्फोरस। तो तीन में से कोई एक दवाई सिम्टम मैच करके आप दे सकते हैं। Dr. Samasi sir had a patient who perfectly of narrating symptom talked about dreams being chased by militants, police, mobs, or robbers, sometimes falling from high place, after which he had pain in the abdomen. Now, dreams of following. So, now dreams of following means what actually? That is important to understand.
Persecution.
So, just give me some water. Yeah. So, it's a very interesting question. See what happens. The patient talked about dreams of being chased by militant police, and it's a very specific dream. So, this is now this is a very interesting dream. Plus, you have to understand where basically you have to find this symptom and how to find this symptom. Followed by, it is not persecution, it is followed by. It is followed by. He is being chased by. So, if you are chased by something, that means there is a fear. And especially if it is basically militants or police or robbers, that means enemy. It signifies enemy. Or he has done something wrong. That's why there is a problem. So, one symptom you have to do is there is a delusion pursued by enemies. One. Second, chased by. That means delusion, enemy, everyone is an enemy. That's also second interpretation. This is very important. And third, you have to think about fear of self-harm. In these cases, if you basically repetize these cases, there are 2 or 3 remedies which will fit in all the rubrics. The first remedy that comes to the mind is pulsatilla. You look at pulsatilla mental symptom and you will see that everything matches with pulsatilla. Second, the remedy is mercury. Third, the remedy is anacardium. And fourth, the remedy is hyoscyamus. These are the 4 remedies which are very, very close, which can be used in this case as permutation combination I have given you. Now, if you are chased by somebody and you are running, that means the other person is basically trying to harm you by mentally or physically. That's why self-harm is important. I did not go further. If I go one step further, I'll tell you one thing also. The patient has done something wrong, but he has not been caught of his wrongness. He cannot speak out because there are some limitations. So he fears that in the dream, what if people know that I have done this and I have done that, and they try to harm me. And that's why this self-harm is very, very important in this case. If I was a prescribing doctor, I would have taken self-harm. More important than exactly the dream of being persuaded. Because if something is coming in the subconscious mind, that means there is some problem in the conscious mind, and the conscious mind is not able to get that out from the system. That's why the subconscious mind becomes alert and you get that in your dream. This is the important. Understood? And you will see so many cases, have this type of dreams. That somebody is chasing, the police are chasing. So it's delusion. It's a delusion, yeah. So this is important in these cases, because you have to understand that if something is told by the mind in the dream, it is basically non-verbal communication. And that non-verbal communication becomes an important symptom of prescribing. This is important. See, because everything if you say by if you take just by that way, you will never prescribe. Like for instance, one of the doctor told me that there's a dream of explosion. Now this is also very important. Now this dream is also very important, especially especially in this scenario where there's a war going on and the patient is a very sensitive patient, and that's why you can feel that explosion and bomb. That is important. And if you get that, that means you have to say the mind is very sensitive, the mind is very fearful, especially towards the cruelties and harm of the human life. And then you can start thinking and prescribing these type of remedies. That is so important. Actually, I had asked you a question, my case, which I cured, but I think nobody could get the answer. Nobody wanted to study that, but that was an interesting case which came out with the medicines. So next question, we have fear of disease. Now, yeah, there are many of remedies. There are so many remedies. And fear of disease is basically, the patient has that backlog in the mind that he has seen a patient of cancer, he has seen a patient of kidney, he has seen a patient of diabetes, and he feels what will happen if I get this XYZ disease. So if that is there, don't take that symptom because that is taken as normal. And fear of disease in generalized, if you want to see, there are so many remedies. You can think of any remedy which has basically fear. The timid patients and all, they have these type of symptoms. So if you just want some remedies which I have used in my practice in the fear of disease, you can write down. First, it is kali carb. Second is phosphorus. Third is a very interesting remedy. Calcarea carb and calcarea ars I have used lots. Then comes Califos, Naxomega, and Pulsatilla. These 8 to 10 remedies I have seen lot of cases I have been able to treat with these type of symptom remedies. Now, one question she asked me about explosion. Now, if you basically try to again prop the patient inside, deep inside, he will tell you more thing, Dr. Meera, that he feels there is something bomb explosion, everything there is disaster, everything that is broken and shattered, and everything is just turned into a graveyard and all. So basically, this is a disaster. The patient suffers from fear of disaster. Fear of disaster. And whenever I had a very interesting case, a recurrent throat infection. Now, I had tried a lot of remedies. I took the case and tried a lot of remedies, but the patient was not getting cured. He was getting relief, but not cured. And then, as we tried to probe into the case detail, he told me that he feels as if a bomb, like where a nuclear bomb, if it is explodes in Nagpur, what will happen to Nagpur? Everything will be burned. I will be burned, and this type of fear he had. So I just took one rubric, fear of disasters, and added some symptoms of throat, and I gave the remedy. You know which remedy I gave? Vithya. The remedy which I gave was Vithya. Now, if you see Vithya has lot of symptoms about the throat, but this fear of disaster is also there in Vithya. If you open the Mathematica Vithya, there are good symptoms of throat. That means a Vithya patient is always always clearing the throat, and very difficult in swallowing. And a Vithya patient has always a constant desire to swallow the saliva like this. When he's trying to tell symptom, he's always swallowing saliva, constant desire to swallow saliva, plus fear of disaster, which I learned from that case. Vithya. It's a very interesting remedy. Vithya, common name is, I think, poison weed. Vithya. Yes. Fear of disaster. And that patient came out fantastically with Vithya. I gave Vithya 1M single dose. I think I repeated that after a month. Within 2 months, within 3 months time, the whole throat complaints was better. He could eat, drink, cold, warm, everything, no complaints. We got the Hering's Law of cure, and Vithya 1M cured the case. Even the fear of disaster was cured. He still sometimes feels what will happen if nuclear bomb is thrown everywhere, but he doesn't have the fear. That also was taken care of. So these are very, very important. Sometimes one or two symptoms of a very polycrest remedy we normally don't study in our day-to-day practice, but our experience of failures teaches us. So that was, I was just adding something, Dr. Meera. I hope you could get something more about that. So do we welcome Dr. Jadhav, Dr. Madan. You have joined it. So can you guess the remedy which I gave to that patient admitted in the hospital? For the first time, for the first time, okay, if anyone can guess the remedy and why, then I'll tell you how did we prescribe. Yes, 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 very right, very right. So, Dr. Babal, now picture of war are coming definitely, because I have some patients from Europe also. No, the fear of bomb, no, fear of disease, fear of death, anxiety, and inconsolable anxiety. Every those symptoms are coming on, and in some cases those are very bad. In some cases they are okay. So there are few remedies basically which comes to our mind in these type of complaints, and there are a lot many of symptoms, of anxiety and apprehension and all. So these symptoms are bound to come. So I what was the remedy which I prescribed for that case? Anybody guess? You know that case, no? And see the nystagmus corneal. This question actually was asked in my last YouTube also, and I told you I have a case. I have a case which is much better, not totally cured, but much better with homeopathy medicines. So that case where I prescribed for oral thrush, a lot of oral thrush were there. You could see the white patches on the tongue. Remember, if there is a fungus growth on the tongue, the white patches you can see, the redness of tongue is a normal symptom of fungus. If you try to prescribe on that symptom, you will never be able to cure it. Oral thrush of fungus on the tongue always comes because of low immunity, dentures, diabetes, dehydration. So when the whole constitution goes down, then the immunity goes down, then the patient gets these symptoms. So it is very important to understand the patient's constitution. I prescribe that patient a single dose of arsenic, and beautifully after 1 day, 24 hours, patient out of the hospital, the thrush went, everything was fine. If you have read Clark Mathemedica, one of my favorite books, he has written arsenic is the horse remedy. Arsenic is the horse remedy. What is the meaning of horse and why it is written? Lot of students might have heard this type of symptom. Arsenic is compared to the race of horse. Can I ask you why arsenic is compared to the race of horse? Yes, anybody? I think Dr. Alexander would answer this question very properly. Why arsenic is compared to the race of horse? Just as pulsatilla is compared nervous disposition. Can we go further? Anybody? Like pulsatilla is to the sheep and antimcrude to the pig. Horses rarely sit. Okay. No, think something more. Think now clinically. If a patient comes to you and he's not sitting, so will you prescribe arsenic? If a patient comes to you, he's showing very nervous temperament, nervous disposition, will you prescribe arsenic? Giving exams is something different. Strong. Okay. See, it is beautiful. You have to read Mathemedica every day, Remember one thing, I prescribed arsenic on the constitution in 24 hours. Thrush goes, the patient was on saline basically for that dehydration, but out of the hospital, walking, reports normal, talking, everything normal. Remember one thing, write down in the write down in your notes. Arsenic is the remedy, comes under antipsoric family of animals, aristocratic family. Okay. Right, restlessness. Okay, Mishra ji, hum samajh gaye. Write down these wordings in your notes. Arsenic is the remedy for the effects of fits of prolonged endurance. Effects of feats of prolonged endurance. That's why it is compared to the race of horse. Prolonged effects of feats of prolonged endurance. Remember these 5 words for arsenic. Up till now, you must have heard people telling anticipation and fastidious and everything. But this one line sums up the whole arsenic like horse. Are you getting me? And it is written in the Mathematica. For its power of strengthening the muscles of both of the limbs and of the breathing apparatus. My dear friends, write down this word, the sentence in a Mathematica. Its power of strengthening the muscle both of the limbs and of muscles of the breathing. And that's why arsenic is so much used and abused in case of asthma, because muscles of respiration also require a lot of strengthening. A horse, he keeps running, is always active, does not sit. So elements from effects of feats, FEATS, of prolonged endurance, it strengthens the muscles of both the limbs and of the breathing apparatus. This is arsenic. I had cured a very beautiful case of atelectasis on allopathy medicines, on inhalers, just with 1 dose of arsenic 200. Just a single dose. Only these 2 symptoms I took for prescription, which I am sharing with you. Normally, I share Alan's keynote, but now we have to lift our Mathematica a bit from the keynotes to the very important prescribing symptoms of arsenic. Are you getting me? Are you with me? Are you with me? Yes, anybody? And that's why you again write down. It acts much more powerfully on vegetable eating animals than on a carnivorous. And it is suited to effects of excessive vegetable like melon, strawberry, and fruits in general, especially watery fruits. That is arsenic album. If you have not written this, please write down in your notes. This is the whole sum up of arsenic. See, one case now also, today also, teaches you so much about the remedy. Arsenic is compared to the race of all. I had learnt in my college days. That immediately struck me on that case. I gave the patient arsenic and the patient beautifully came out with that. Every symptom sometimes becomes a summary of the case. I did not ask whether it is aggravation night or nothing like that. The whole summary is so important. See, it acts more powerfully on vegetable eating animals than on carnivorous. Exactly opposite to which remedy? Can you think about the remedy exactly opposite to that? Anybody? It is written that arsenic acts powerfully on vegetable eating animals than the carnivores. Exactly opposite to which remedy? Nakswamika. And it is suited to effects of excess of vegetable in diet. Melon, strawberry, fruits, especially watery fruits. Problem starts when the patient comes and tells you that I have eaten watermelon or marshmallow or something which is related to or oranges or mosambi. We normally start thinking of remedies like acid force and all. But if that causes a problem or that, think about arsenic album. This is arsenic. This is the Mathematica which you have to learn. Understand? This is so much important. Of course, then I will not say it is not. Restlessness is present, burning is present, anticipation is present, irritability is present, everything is there. But if you know that core symptom, then that becomes a very, very interesting and prescribing symptom of arsenic album. I hope you got some knowledge about the case in arsenic. I hope everybody got something about arsenic, something more than what I have taught you before in my practice. I was so actually, when we cured the case, I basically told my assistants and all, and they were first told me, sir, this time in webinar we'll discuss arsenic, and you just tell us these 2-3 lines, because nobody maybe have not read about these lines, and that is so important. That is arsenic. It affects it strengthens the muscles of limbs, such a beautiful thing, and respiratory apparatus. That's why arsenic is so much abused in a day-to-day practice. I hope you will read something more about arsenic, and if you have some questions, I can definitely answer those. So one questions have come, so I'll definitely first see the question. A patient 35 years went for breast enhanced operation, pains post-operative, not healed yet, psychologically disturbed before 15 years, having small breast. Now, after operation, difficult to accept the change. Okay, this in a short 4 lines, the patient has done that breast enhancing operation, was not happy with the small breast. So the patient basically is very self-conscious about her looks. Okay, now you have to ask the question to yourself, who are the persons who are very self-conscious about their looks? They are those persons who want to be known, appreciated, and liked by their looks, because they think that that is the only part in them which will get them appreciation and glamour. So this is their product. You have to take this is exactly a psychotic miasm. If you don't have the intellect and you only want to impress by your just by your body, then those are the personalities. Don't always take inferiority complex. An intellectual also can have an inferiority complex. How? He feels that he has practiced for so many years, but he is not getting results. Though he is very good, though he is a good teacher, though he knows everything in the mathematics and organon, but still there is no practice. That's an intellectual cause of concern and loss of confidence. So this is important, that the whole psychosis, basically the appearance is important to the patient. Self-consciousness is there. You have to ask the patient why. Second, after the operation also, the patient basically is not happy. So is there a discontentment in the patient, dissatisfaction in the patient, or the opposite? There's a lot of gluttony. Everything wants more, more, more. That is also there. Or the patient feels that it was a mistake, that he did the operation, and now what will people say, how suddenly the breast have grown? That's also a problem then. In these type of cases, these are the entry points of the case. You have to see what was the SORA. If you get the SORA, then club with psychosis and thermals, and then you can get to the remedy. Don't always think that after all operation, after this operation, that operation, the patient is very bad and all, and he got the symptoms, so give Stephen's give Ledampal. It does not work. The whole constitution is there. No, the patient is not satisfied. So the whole constitution basically is under trauma. So think as a constitutional medicine to prescribe this type of patients. Okay, don't prescribe Stephen's or Ledampal. I have not got a good experience in these remedies in these type of cases. Okay, so let us go further. Any other question about the remedy? Yeah, so arsenic, I was today hoping to tell you something about arsenic, and I'm very happy that I could really tell you something about arsenic, which you will understand sometimes in your practice, in your cases, that there are no symptoms of the case, but you have found out that the whole constitution needs that rejuvenation. Arsenic works very well. So we took those 2 symptoms for prescription, and the patient came out beautifully with arsenic album. Let's go further with some different questions. Of course, then I told you something reverse of Naxomic. You must know Naxomic also. Share your day-to-day practice of body language of patients. For that, Mishra ji, आपको मेरे क्लिनिक जब पेशेंट कुछ तो भी एक्टिविटी करता है ना, और तब मैं बताऊँ, देखो ये एक्टिविटी करने के बाद, if the patient is doing something in front of my patient, so it will be very interesting to you to understand, to know that how the patient is doing and why the patient is doing, and how I prescribe the remedy. So for that, I think I told you before also, some cases, some doctors basically are joining me live on my Skype clinic. So I start the Skype clinic and they can join me. We are doing it every Saturday now. Today also we have done at between 12 o'clock to 12:30, half an hour. So whatever patients they come in my OPD, there is no अब मैं पहले से पेशेंट को बुला के रखता नहीं हूँ. जैसे जैसे पेशेंट मेरे ओपीडी में आते हैं फॉर हाफ एन आवर और फॉर 1 hour, यू कैन सी हाउ आई टॉक टू द पेशेंट, हाउ आई प्रिस्क्राइब. If there are patients, if there are no patients, then there's a problem. But by the grace of God, there are patients. So you can join my Skype clinic and you can see how I prescribe on the body language also. Okay, it is better I teach you clinically rather than doing just symptoms, that if the patient is itching on the पेशेंट खुजा रहा है सर के ऊपर, मतलब उसको बहुत स्ट्रेस है, और राइट साइड पे खुजा रहा है तो कुछ और है, लेफ्ट पे खुजा रहा है तो कुछ और है, बाल सेट कर रहा है या बाल झड़ रहा है आगे से पीछे. तो देयर आर लॉट ऑफ थिंग्स. बट when you sit in my if you see my clinic chamber, and then I'll tell you something that will be very interesting for you. Skype clinic means, I told you, there are I take about 5 to 6 doctors. I start the Skype, and then yes, Dr. Weber, it will be in Hindi, so it'll be a problem. And I don't teach in Skype because it is live clinic, and because of the rush, I see the patient in few minutes, he's out, next patient is in. So I cannot explain you exactly, but you just keep that in your mind, and you can ask me, sir, why did you what was the patient that time? They can explain everything about the patient. So that's also working well, so that the patient can actually so doctors can be actually in my clinic live, and then they can see exactly what I'm doing in my practice, in my clinic. That's also very important. So something I told you about the Nux vomica, reverse of arsenic album. See what happens, in Nux vomica. Of course, if you have read Nux vomica in your Allen's keynote or basic books, you can get the basic idea of Nux. But as you go further, as you go further in Nux vomica, remember one thing: the keynote of Nux vomica is. Can anybody tell me? There are 2 keynotes of Nux vomica that has to be always kept in the mind. And what are those keynote? Anybody? There are 2 keynotes that you have to keep in mind of Nux vomica: ardent, sadhana. Actually, what happens in India, most of the wives are very ardent to the husband, but they are not Nux vomica. 2 keynote of Nux vomica are very, very important, and you have to know that. Of course, if you see ardent, Nux vomica is there, causticum is there, sulfur is there, but I am asking you a very specific indication of Nux vomica: benevolence. Okay, can you go further? Nux vomica, you first have to remember. So I am asking you the 2 keynote symptoms. I am not asking you the constitution. Nux vomica is definitely a zealous personality. I'll go further, First, I think we'll go with the case. Sir, patient came to me saying headache starts every day around 1 p.m. to 2 p.m. Which remedy we think of? No, see, now if you ask anybody in homeopathy from first year to a very good prescribing doctors, 1 to 2 p.m., every second doctor would tell you arsenic album. But don't prescribe arsenic album. The type of headache, how is the headache aggravated, and what does the patient do during headache, and how he feels better with headache. Those symptoms are prescribing symptoms, That's important for us to know. Nux vomica. First, you have to remember Nux vomica, spasm. Spasm is the first keynote of Nux vomica, and the second keynote of Nux vomica is exaggerated sensitiveness. Exaggerated sensitiveness. हर चीज में ज्यादा, लाइट में तकलीफ, बाहर से काम करके आया तो तकलीफ, रात को नहीं सोया तो तकलीफ, बहुत आवाज आएगा तो तकलीफ, बहुत बास आएंगी तो तकलीफ. Everything is exaggerated sensitiveness and spasm. These are the 2 keynotes of Nux vomica, Anybody? Then you can prescribe Nux vomica. You can have spasm everywhere in the body, convulsions with consciousness, that's also spasm. Exaggerated sensitiveness is a case of migraine. The patient says, I cannot bear the light, I cannot bear the dust, I cannot bear the smoke, XYZ. That's Nux vomica. And then, as some of the doctors are telling me, zealous and defined, zealous and defined. So, see, whatever, I don't know, whatever pre-inclination thinking you have about Naxomika, but this is basically what I've seen in practice and very easy to understand. And now, one doctor said ardent personality, of course, zealous personality also, of course. A personality who gets angry and excited very easily, that is Naxomika. Bilious temperament, thin, irritable, drugged subjects, those are Naxomikas. But two symptoms, keynote spasm and exaggerated sensitiveness, are very important to know about Naxomika personality and Naxomika, what you call symptom, keynote symptom. Those are very, very important. That's Naxomika. Yeah, cuprum has also spasms, or Macphos is also spasm. No, but the first remedy that you should think about is Naxomika. And if I tell you why, I can give you the spasm of cuprum metallicum, I can give you about Macphos, I can give you Naxomika. But why Naxomika? Because both these symptoms of Naxomika are brought in front of poisoning cases, and the provings brings out their developments in almost all the regions of the body. That's why Naxomika is the first remedy you should think about in spasms. Did you get that, Dr. Lisa? Such an important aspect of Naxomika that you have to remember. Of course, then you have cuprum metallicum. Also, very important symptom of cuprum metallicum is basically those symptoms as you told me. But there are other symptoms of cuprum that has to be known. In cuprum metallicum, if I can, if you don't have any questions, if I can, I told you. In cuprum metallicum, one thing is very important. It is this power to relieve internal spasms, which renders the. So this is very important. Okay, you have got the answer, so I don't need to tell. That is so important. And in cuprum metallicum, remember one thing. Convulsions, spasms of the most violent form coming from disappearance of pain, disappearance of discharges, disappearance of eruptions, and disappearance of mental derangement. The patient goes in spasms, and or with the suppression of menses, the patient starts screaming. That is cuprum metallicum. That is the difference of Nux and cuprum, suppression and the poisoning. This is important. Reserved, reversed displeasure. This, I think, lot of doctors would be able to answer this question. Dr. Mishra जी, हम डॉक्टर से पूछते इसका आंसर कैसा करेंगे? So this is cuprum metallicum, okay? So what can you answer about reverse displeasure? वही क्वेश्चन डॉक्टर मिश्रा, वही क्वेश्चन है आपका? So that was cuprum metallicum, that was Naxomika, and of course then no. Nux means spasms. The patient goes in spasm because of poisoning symptom. One comes from inside out and one goes from outside in. That's a difference. And if you understand magnesium first, that is also very important, goes in spasm. But in magnesium, in Mac first, there is something different in Mac first, especially as Dr. Nash says about Macfall, it is a first rank remedy for all kinds of pains. All kinds of pain, especially cramping, is the most important symptom. Except burning pain. And that is the difference between cramp with burning and cramp without burning. Cramp with burning becomes arsenic. Cramp without burning becomes Macphos. That is told by Dr. Nash. Yes, so why pulsatilla with sheep and why antrim crude with pig? This will be the question answered by some of the doctors on next YouTube live. Okay, so I'll wait for some of the answers, then we'll go further. Today the horse was important because of I exactly cracked that case of horse. That's why I had that internal itchiness to show you everything. Okay, Mishra ji. Apart from Nakswamika, what else we can give for exaggerated? Yeah, Dr. Meera. So we have lot of remedies. Like for instance, yeah, anybody? Now, if the patient basically is very sensitive to impression, you can think about phosphorus, you can think about nitric acid, you can think of staphylococcus, you can think about colchicum also. There are a lot of remedies. Lot of remedies. An alcoholic person had a delusion that his wife is having relationship with other men. His wife wants medicines for him. Now you have already written the answer. An alcoholic person means the person is already intoxicated. So if he's intoxicated and he knows that he is doing some mistake, and because of the mistake the wife is not happy, and he feels as if the wife is not happy, so she might have relationship with some other person. So that is a symptom of the intoxicated person. Go and ask what was the sora. That is important. For example, a person feels that if he's not a male feels that if he's not performing a physical activity or he is impotent, his wife will run away. So which remedy comes to your mind? He is thinking that if he cannot, there's a problem with impotency, he's impotent and he cannot do the physical activity, so his wife will run away. Actually, the wife said there is no problem, but my husband feels. So which is the remedy for this type of symptom? Yes, anybody? So the question is open to you. Good evening, Dr. Vaibhav. And Dr. Sangma says treating urticaria. Whenever you are treating urticaria, you have to first see what is the condition where the urticaria goes or starts. Now this, if you understand, you'll be able to treat urticaria very, very easily. For example, if the patient comes and tells you that whenever the temperature becomes cold, the urticaria starts. Which remedy comes to your mind in this case? Anybody? डॉक्टर साहब, जब भी ठंडी का मौसम आता है ना, एक तकलीफ मेरे को बहुत रहती है, मेरे को खुजली बहुत बढ़ जाती है. Whenever winter season starts, I starts getting itchy. So which remedy comes to your mind? Anybody? So the first remedy that you should think about if the cold aggravates, a simple remedy, Rustox. Simple remedy, Rustox. Where I am telling you the aggravation. The patient says whenever there is a cold, जब भी ठंडी आती है, I start getting it. Think about Rustox, think about sepia, and think about nitric acid. बस तीन ही रेमेडी सोचो. But if the patient comes and tells you that whenever the winter comes, I am very happy, my itching goes, then the reverse remedy you have to know. Which are the remedies exactly reverse to that? Anybody? Which are the remedies that you should think reverse? Whenever there is cold, whenever the weather becomes cold, I start feeling better. The remedy becomes, I have sent the picture to him. No, picture you will not be able to judge urticaria, because in urticaria the papules are either a very small, not important, big, not important. Importance is how does it aggravate, when does it come. I was just giving an example. In cold aggravate, Rustox, sepia, nitric acid. In cold the patient is better, dulcamara and calcareacar. In this you have to understand. Or the patient tells you that whenever I have a bath, जब भी मैं नहा के बाहर आता हूं, मेरा अर्टिकेरिया में तकलीफ होती है. I have eruptions, I have urticarias after having a bath. Very, very important symptom of Artica urens after bathing aggravates. Now, somebody has told me about petroleum. In petroleum, remember, urticaria is because of cement. That is petroleum. So this is important. When does the urticaria occur, and how does it? How the patient feels better? He'll tell you, I take some antihistaminic, I feel better. No, don't take that for prescription. Some patients comes and tells you, yes, very strange, Dr. Alexandra, but it is there. It is there. That is what I'm telling you. In Mater Medica, like for instance, I told you calcarea carb, everybody knows is fair, fat, and flabby. But I told you when calcarea carb is thin in respiratory disorders. Because if a thin calcarea carb walks in front of you, you say, no, it is very thin, so it is not calcarea, it's going to be calcarea phos. But calcarea carb is also thin in that complaints. Dr. Sangma, I'll just complete that. Most of the patient comes and tells you that whenever I am tensed, whenever somebody is coming at home or some guests are coming or I have to face an exam, and whenever I am emotionally traumatized, I get itching in the body. In that case, do think about Bovista, Calibrome, Anacardium, Pulsatilla. Yes, Bovista is there. Anacardium, Pulsatilla, Calibrome. Whenever he's going for business, a property deal, he feels what will happen. Property ka soda hunga, can it will happen or not happen? It uppers. Calibrome, I have cured so many cases of urticaria with just by single dose of Calibrome 1M. Or some patient comes and tells you, some patient comes tell you, okay, whenever I'm doing a lot of exercise, I'm going to the gym. I'm going to the gym, and when I do gym, there's a lot of itching in the body, and I get a lot of papules. So after violent exercise, also there's urticaria. Think about Artica urens. Think about natramure. Think about sorinum. Think about conium maculatum. So this is how Dr. Sangma try to find out. Or some patient tells you, whenever my stomach is upset, I get urticaria. Or some tells you, whenever before menses, I get urticaria. Or some patient will tell you that whenever I'm eating vegetables, I get urticaria. But some patient comes and tells you, whenever there is a lot of urticaria, and if it is when somebody touches that, I feel too much pain and irritability. That means the urticaria is very sensitive to touch. Which is the remedy comes to your mind? Just one question, then we'll shift to other questions. Oh, it's already 3:58. My God. So one, when the urticaria is very sensitive, everybody remember one remedy very, very important. Which is that remedy? Where the urticaria is very much sensitive, my dear friends, one remedy is very, very important. Which is that remedy? It is not copaiva. Eating cheese, basically, you will have actually a lot of cases, by eating cheese, the patients get urticaria. But in this case, whenever something food comes, so I've seen it does not cure that complaints. Because if cheese was the cause, lot of people should have got urticaria itching. Why this person? But definitely, if you prescribe some, if you see some of the remedies in that, it may just temporarily give you some breathing time. But I've seen it can never cure that urticaria, because today it is after cheese. Sometimes it may occur with some other food, and you will keep on changing remedies. You keep on changing remedies, and you will not be able to cure that complaints. That is important. So don't take that cheese. It will keep changing the food items, and you will keep changing and stopping that. So you'll not be able to cure that complaints. Okay, next we go. Of course, if you want to see the remedy is either Antium crude, Pulsatilla or Naxomica. Mishra ji ने कहा है, अच्छा urticaria very sensitive, Aztec, no, it is not that remedy. So this is the question for the next webinar, next YouTube. When we meet, I need two answers. Urticaria very sensitive, and what is the meaning of how do you compare Antium crude with pig, and how do you compare Pulsatilla with sheep? I have told you one thing about the horse. 2, I think you can answer the question. So, no, it is not calcarea carb, Dr. Amol. We'll see in the, no, it is not epismel also. It is not sheep to pig. Yeah, antim crude. So I will maybe will maybe meet in the next YouTube, and I will share some of the experiences why this remedies was prescribed and how it is prescribed, and I told you something about the horse, the rest, the fit or the muscles part, and those are very important symptom. So this is something related to what I have understood in that case. That's why today I wanted to share, because I got the remedy. Pulsatilla to sheep, Dr. Shoaib, and antimicrobe to the pig. That's the three things we see. Histamine. Histamine remedy I have not used in my practice. So in these articaria cases, no, it is not Bovista also. So it's already 1 hour up. So thank you for everybody for joining. We have a lot of questions that I'll answer maybe in the next YouTube live. Thank you everyone for joining. Thank you so much.